Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to another episode of the Healthcare Connections podcast. I am your host, Jeremy Wynn, the Director of Sales here at Healthcare Compliance Pros. We have a really fun guest today. Sometimes she'll say she has a little too much fun as we talk about her adventures. But we've got Christina Hall. She is the founder, owner, everything at Hall Social. Welcome, Christina.
Thank you for having me. I am really excited to be here. I'm so excited for this.
Me too. Me too. I've wanted to do this for a while with you, and so I'm glad it finally worked out. But I'd love, before we jump into this, I'd love the audience to get to know you. Again, they're going to learn how much fun you can be. And I'd love to hear your background, how you got into the crazy world of social media and marketing and healthcare specifically as you've done that.
Yeah, so I was actually telling this story just yesterday, and it all started with a Craigslist ad. So this is when we really used Craigslist to find jobs, and I graduated with my bachelor's in journalism back in 2011. I was at an internship, unpaid, of course, and just what am I going to do next, right? And so I got on Craigslist and I saw an ad that said social media manager wanted. I had no idea. What is that? In 2011, what was a social media manager? I always say like Facebook was a cool kid and Instagram was like the ugly stepsister.
Yeah.
Like it's right. Like nobody was using it, but I applied for it. I got it. Nothing ever happened with it, but it catapulted me into this industry that wasn't even an industry yet, which is so cool to say. Like
Yeah.
I have not met one person that has been doing social media marketing as long as I have. And so for years, it was 7 years, I freelanced. I was just doing it on the side. I never wanted to make it a full-time business. I was like, I'm just going to try to do the corporate thing, right?
Yep.
Obviously, that didn't last. So in 2019, I decided to go full-time. And I had nothing in my savings account. I was getting my MBA, and I said, I'm going to bet on myself. And that's exactly what I did. And so in 2020 is when I really started to see the healthcare industry.
Yeah.
And I started with dermatologists in 2019, but I didn't want to take on too many clients because I was trying to finish out my MBA. And so once I did that, I just started working with healthcare way more. And it was a happy accident. It was truly a happy accident. And what makes me laugh is that my mom and my stepdad are physicians. My brother is a pharmaceutical rep.
Okay.
Everybody was like, Christina, work in healthcare. I'm like, no way, you guys are nuts. I'm not ever being a nurse or anything. And then here I am. I found my own way into it.
Right.
And I love it. I love it. I love working with healthcare. And it's funny because a lot of people wouldn't say that. You see a lot of social media people, they want to work with the influencers and, just these really exciting industries. And I find healthcare exciting. So that's why we're here.
That's how we met. So, Christina, one of her clients is an organization that we work with a lot, NSCHBC, and this is a mouthful. And if I get it wrong, Shane, the president, will smack me. But it's the National Society of Certified Healthcare Business Consultants. Did I get that right, Christina?
You said it way better than I could have, and I've been working with them for 5 years.
So we met in January as I went out to one of their shows, and Christina was there filming everything, filming the little speech presentation I gave, and she was so kind to send it to me so we could use it on our social, and so that was when we met, and I've just been impressed with everything that she's done for that organization. So wanted to have you on to see you could talk about some ideas and topics that would be interesting to our clients. Again, we're healthcare, right, as well, and we have we have clients in all different types of specialties in healthcare. So I think this could be a really good thing for them. So first thing I want to dive into, in marketing, especially social media, you hear everywhere this concept, this phrase that content is king.
Yep.
And I think we all understand a little bit, why that is as we dive into and are drawn in by this content. But I'd love to know, Christine, if you could share some insights on the type of content, because you can't just be content.
Right.
I think we need to really dive into what type works, and particularly around healthcare. What's the content in healthcare as you're working with practices that you're seeing is helping them grow?
Yeah. So, a lot of the times when I start working with a healthcare business, no matter if it's an organization, a practice, whatever it looks like, they're always using stock photos, right? So you're
Yeah.
seeing that very stock image with the text and all that stuff. And listen, I've been doing this for almost 15 years at this point, and I use stock images for a long time too, right? Because that's just what you did. And so I'm seeing, right, I'll see people do that all the time. But as we've all known, especially over the last 5 years, going through COVID, especially,
Mhm.
we crave community connection.
Yeah.
And I always say people are nosy on social media. And so they want to see the ins and outs, they want to see the behind the scenes. They want to see the real person. And I know everybody says this, but authenticity really makes a huge difference, right?
Yeah.
And so I always say instead of stock photos, like, and I'm not saying graphics, right? There's a difference. I'm saying stock photos of people that nobody knows. Once you start using real pictures of people, it makes all the difference in the world. So let me share a number with you.
Yeah. I'd love that.
And yeah, I'm really analytical. I love metrics. One of the things we do for all of our clients is monthly they get metric reports, right? So they're always going to know. And at the end of each year, we do a year in review, right? And so this year we were like, I mean, my mouth dropped when I ran these reports because we had been working with this client for about 5 years now. And we were using stock photo for a long time because we just couldn't get the real footage that we needed. And so I developed content days. And what that essentially is how you met me, right? Where I go and I shoot content so the client doesn't have to worry about anything.
Hmm.
I take all the pictures, all the video, XYZ. And so we finally got this client to do it. And within a year, we had a wow, just looking at these again is crazy. We had a 67% increase in reach.
Wow.
We had over 4,000% increase in video growth because what we did when we went out to this
Wow.
client is we did interviews. And so you might have seen me do them at the organization, but I'll do interviews and I'll ask questions and then we
Yeah.
use that content, right? So our engagement, just from making that one switch, our engagement was up 42% within, 8, 9 months,
Wow.
right? And now we just shot for them again 2 weeks ago, and this content's even better. So I cannot wait to see how this performs because it's 10 times better. So from and that was all because we started to utilize real people.
Yeah.
We were showing the company, this company, I have never seen a company culture like this in my life. It was so impressive and inspiring to see. And I wanted to convey that on social.
Yeah.
And the numbers don't lie. Like the numbers don't lie. So that's my first piece of advice when it comes to photos. If you're going to use photos, cool. Just make sure that it's like actually the people who are working your office, you. And again, I know it's scary to be on camera. I know it's uncomfortable, but it is the thing that's going to make the difference. And that's just the facts. So
Very cool.
that's stock photo. Then going over to video, and the NSCHBC was this case study specifically. And oh my God, again, it's like so impressive to see. But just in 2023, we were at almost a million like reach, our impressions, right? So
Wow.
we hit almost a million over there. Our engagement, we were in 30,000, and that was really good for us, right? But right, everybody wants to know, okay, cool, metrics, but conversions. What about the conversions? What did we bring in? I'm gonna get there. I have that too. So basically, the NSHBC, we ended up getting their cost per lead to $28, right?
Yeah.
When you do all the math, we ended up generating 780 leads. Now, that's leads. Their website needs a revamp. We're working on it, right? But we were driving the traffic to them, right? And so I'm just trying to look for the number. I thought I had it on here. I'll have to look somewhere else. But either way, we were able to bring in membership.
Yeah.
And when I ran the numbers last, the membership, like we were making money, right? So like our first 2 years before we started utilizing the videos, we were in the red. We were not making any money at all from lead, like from conversion to like membership, right? As soon as we started implementing that, I think the first year we made $5,000. So I believe so our first year we were up $5,000
Mm-hmm.
when we started to use this. Our second year we were up $10,000.
Wow.
And then we were only spending well, no, that would have been the profit after the spend. Yeah, so we had really good numbers over there, and it was because of that video content. We were talking about Vinny earlier, and I don't know if you saw it, but he shared a video about his favorite memory of the NSEHBC, and the memory was Wally thought we had international like members and didn't realize Vinny lived in the States, and it's so silly and so funny. We gained 5 new members just off of that one
That
video.
one video. Oh my
That
heck, that's amazing.
one video. And it's so silly. And like the boys are like, oh my God, like this is so silly. I was like, yeah, but look what happened.
Yeah.
We were literally able to convert it. So yeah,
That's
yeah,
so funny.
it's video content is going to help with that conversion. At the
Yeah.
end of the day, my job is to drive traffic to your website. And with the NSEHBC, we very much did that. We were able to drive, and that was just 1 year,
Mm-hmm.
right? And so, I always say that social is just one part of the funnel. If your website is not up to par, your website has to be able to convert, right? And so, with that being said, I'm going to do my job. I'm going to get you the traffic. What happens after that, right? We'll discuss that. But yeah,
Very cool.
so video content and real people.
Okay. Love that. That's great. That's great advice. Yeah. Thank you for that. Okay. So
Yeah.
let's jump into, you were talking about this theory with me,
Oh, yeah. Thank you.
in our digital age, and, this age that we live in. So I think it'd be valuable to have you, and talk through that again with our audience about your theory.
Yeah, I like thought about so it was funny. I was speaking at a financial conference last year and was prepping my, presentation and everything. And that's how I started to think about this. As a millennial, right? We're the adults of the world. Crazy, crazy to think we're the adults of the world.
All of a sudden, that millennial age is yeah.
Exactly. And when I think of healthcare, right? Like, okay, we have, a lot of people have kiddos. Those kiddos have to go to the doctors, things like that. And so, millennials, we're on our phones, we're on social media.
Mhm.
That's just the reality of it. And the way to get our attention is through social media, right? And so, because of just our natural behaviors, like our consuming behaviors, we're always on social and we're going to go to websites. That's what I always say. Anytime I come across somebody like, oh, I like this person, I go to their website and I go to their social media. That's it. I don't even go to Google yet to look at reviews. I'm going to hit those two places first, right? And I'll be honest, a lot of us do judge by the look of your social media. We do. And that does not mean that you are not a great physician or anything like that, but that is our first look into who you are. And if we are looking to choose somebody to take care of our health, our kiddos' health, right? We're gonna want to make sure it's the right person.
Yeah.
And so the beautiful thing about social media is that we can showcase our personalities, right? I always say this: people choose people that they like,
Mm-hmm.
right? I'll ask clients, why did you decide to work with me? I really like you. And I'm like, well, can I get something a little more tangible than that? But it's the truth. And so
It's why do I go to the dentist I go to? It's because he's been a longtime friend of mine, and I like the guy.
you like the guy, right? And so, yeah, if it's a longtime friend, great. But what about those people who you don't know? The
Yeah.
first way to connect with them is through social media. And millennials, that's where we hang out. That's just what it is. I work with a lot of dermatologists,
Mm-hmm.
and obviously, like dermatology on social is a no-brainer.
Yeah.
Okay, and one thing to bring up is one of my derm practices, the PA in the office, she didn't have like much on her social media, on her personal social media. And because of that, she got overlooked for an award.
Hmm.
People are looking now,
Interesting.
right? My other derm, it will be next year. He's the vice president of the American Derm Association.
Okay.
And this man, I can't get him off camera. When I first met him, he would not go on camera, but I have a really good way of getting people there. And oh my gosh, he's gotten awards. He's always traveling. He gets invited to influencer events, and it's because of social media.
Yeah.
I had pitched him an idea back in 2021. We were in Miami at dinner, nice bottle of Italian wine, and I'm like, perfect opportunity to pitch you on this idea. Drugstore product reviews. And he's like, no. I'm like, yes. He's like, no. I said, yes. His wife said, yes. Within 1 year, he got picked up on Good Morning Washington, D.C., and they featured a special on his drugstore product reviews. And
It's so
now
great.
that's all we do. I mean, we do other stuff, but that I would say is 90% of our content,
Yeah.
right? So it's really cool. And so I just think that, again, with the digital age that we live in, you got to be on social media. And there's not many, I always say the one part of this industry that could probably get away with it a little is medical billing.
Yeah.
I'm like, okay, I can understand you guys, but for the most part, yeah, you gotta be on digital. And again, it's not just about social, it's about your website.
Mhm.
Do you have an email funnel? Like, I think people forget it all works together.
Correct.
And so we need to make sure that everything's cohesive.
Yeah, in today's world, people shop on their own prior to
Yes.
them even reaching out, and so you have to be able to tell your story in a creative, fun, interesting way where people can find it before they ever contact you to inquire
Exactly.
more. I mean, that's even in our space. We see that everywhere.
I love this. I know that with healthcare too, like it could be boring. I understand that. Like, it can be, but there's a lot for healthcare providers to do. They can put out so much educational information, especially because we again live in a digital age. You have a lot of influencers, a lot of people like that who are spreading misinformation.
Correct.
I want healthcare providers on these platforms so that they can give the real information instead of this misinformation from some cute influencer girl. You know what I mean? But like that is the reality of it. So, for me, like shooting content is the biggest piece of the puzzle from a social standpoint, and that's why I do it, because I know you guys don't have time for it. So like I can't put that on my doctors. So it's just changed everything for us. It really has, and it makes my job easier.
Love that. Okay, so for those listening that are, it's kind of hitting them like, all right, I got to up my game a little bit. If they're interested in reaching out and inquiring about potentially working with you, Christina, what's the best way for them to contact you?
Find me on any socials, but my website for sure, Hall Social Media, hallsocialmedia.com. As I'm saying, it's not called Hall Social, hallsocialmedia.com, or via email. I am always an open book. And that's like the one thing I pride myself on. Like, I will always tell you the truth and what you need and XYZ. But yeah, hallsocialmedia.com is the best way to find me. And yeah, I mean, let's talk.
Okay, love it.
Fun world out here.
Christina, thank you so much. Love the story of how you got into this. Love the ideas and the advice. Appreciate you being on the episode today.
Thank you. I appreciate you.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.